This is Sunday Live with Jeff Koinange and Olive Barrows.
Welcome to the very first day of December 2024.
Which happens to be World AIDS Day.
We have comprehensive coverage tonight, don't we?
Yes, we do.
Including an interview with Homa Bay Governor Gladys Wanga.
Yes.
The CS for Health.
CS for Health, Deborah Mlongo.
That's right.
Barasa.
And an activist.
Yes, Shalon Watiri.
Young 24-year-old.
She's young and she's an advocate.
And she has a story.
As an advocacy.
Absolutely.
Yes.
Now, indeed. Now, back in 1984, when the first case of HIV was reported in Kenya, there was considerable panic as citizens were faced with a new disease that ate away at its victims. Medics were simply overwhelmed as part of the adult population died, leaving orphaned children in their wake. The country was jolted into action.
That was 1984. Now, 40 years on, Kenya has emerged as one of the success cases in sub-Saharan Africa to stem the spread of HIV, with national prevalence standing at under 3.3%, down from 14.3% at the beginning of this century. A national strategy to eradicate HIV by 2030 has been rolled out, even as signs of hazards ahead lurk. Young people, unscarred by the traumas of the past, are a new frontier of emerging infections threatening to roll back gains of the past.
That's right. Now, in this expansive coverage, we'll look back on the 40 years of HIV in Kenya to spotlight the good, the bad, and the ugly of its interventions. We'll look at the latest data and hear from leading experts, activists, and people living with HIV who provide diverse perspectives on the current state of HIV and AIDS.
To dissect the issues, we'll be speaking to as we mentioned earlier, Cabinet Secretary for Health, Deborah Mlongo, Homa Bay Governor Gladys Wanga, and a HIV youth advocate, Shalon Watiri. The special coverage has been brought to you by Citizen TV in collaboration with the Frontera Media Group. But first, the highlights.
We want to work together. Hakuna haja ya malumbano, hakuna haja ya mashindano ambayo yanagawanya wananchi. Tunataka tutembee pamoja.
Let there be truce. President Ruto calls on church and political leaders to drive the country's development agenda.
Insurance fraud. EACC arrests 2 officials and foils a multinational shillings insurance fraud at the Kenya Maritime Authority.
New HIV infections drop in 10 years, but concerns remain over infections in young adults as Kenya marks 40 years of HIV.
And I'm seeing this as one case that is going to derail our process if we are not careful. We have to be ambitious to end AIDS by 2030.
A double-sided sword. New HIV infections down as donors tighten the tabs.
And welcome to the broadcast. Our sign language interpreter tonight is Belinda Adhiambo. Now, President William Ruto now says the state is not in competition with the church, but instead should be partners in addressing challenges facing Kenyans.
Speaking days after the Catholic Church rejected his donation to the Soweto Catholic Church, the president told an interdenominational church that and that is in Kajiado South constituency, that his administration is seeking to work with the church to resolve long-standing issues raised by Kenyans. Stephen Little reports.
President Ruto was in Kimana, Kajiado South constituency for the interdenominational church service. It is here that it emerged that the donations made by the head of state to the Soweto Catholic Church in Nairobi and rejected by the Archbishop Philip Anyolo has not been returned.
Lakini nisisitize bado haijarudishwa. Unajua nilisikia juzi wengine wakisema imerudishwa mpaka yenye ilikuwa ni ahadi. Sababu rais alipeana kiasi na ingine akasema itakuja baadaye. Sasa hata ile ya kuja baadaye kuna wanasema imerudishwa na haijafika. Utarudishaje yenye haijafika? Inawezekana?
President Ruto told the congregation in Kajiado that the state is not in any competition with the church. Instead, he called on the church to work with the government.
There is no competition between the church and others, or between the state and the church. We are one partners, we are one country. Na wauliza ndugu wa Kenya, nchi hii haiwezi kufaulu kwa migawanyiko. Nchi hii haiwezi kufaulu kwa mashindano ya kugawanya watu. We have to be united. We have to work together. The church and the state must work together.
The sentiments coming a week after President Ruto, while in Kericho, insisted that he will continue giving to the church, and today he did just that. Donated multi-million shillings worth of tents and instructed State House Controller Kato Ole Metito, his host in Kajiado South, to ensure the churches receive his donations before Christmas Day.
Wewe Kato, kwa sababu wewe ndio mtu yangu ya mkono. Hiyo tent ya hawa viongozi wasikule Christmas kabla tent yao haijafika.
Politics of unity also took center stage.
Thanks be to God that Kenya is peaceful. We should never take it for granted. We must always nurture peace, defend peace.
Let us be allergic to all those who preach tribalism. Let us be allergic.
Tufanye kazi pamoja na msikubali kiongozi yeyote aje kuwaletea siasa za ukabila na migawanyiko hapa Kajiado.
Leaders from the Maa community who met the president used the opportunity to request for development projects in the region.
Sisi tumehesabiwa katika serikali yako hasa kwa mambo ya kasi. Wengi wamesema mwenye ambaye uko naye hapo State House ni ndugu yetu Kato Ole Metito.
No religion is going to be left behind. No community is going to be left behind. No region is going to be left behind.
Similar sentiments were echoed by Deputy President Professor Kithure Kindiki, who attended a church service in Kitui County. DP Kindiki warned politicians inciting members of the public to violence, saying that amounts to lawlessness and anarchy.
For those of us who are political leaders, we must protect this country from the emerging practice of political violence and intolerance.
Stephen Letos, Citizen TV.
Former ODM party leader Raila Odinga has today made a scathing attack on the former Deputy President Rigathi Gachagua over his remarks to stop those who never supported the Kenya Kwanza government from accessing State House.
That's right. Raila, who is vying for the African Union Commission chairmanship, said Gachagua's remarks were those of a self-centered leader, and that such remarks were nothing short of divisiveness. Let's get more from our very own Nimrod Tabu.
Former Deputy President Rigathi Gachagua was on the receiving end in Vihiga when Raila Odinga graced a homecoming ceremony for the ODM Deputy Party Leader Godfrey Osotsi. Once he took to the stage, Raila did not mince his words, portraying Gachagua as a man who had a personal vendetta against him.
Muliona juzi mtu mwingine anabweka kule. Anabweka teo, timeweka mitego. Nimeweka mitego kila mahali. Hawezi kupenya. Hawezi kuingia mahali yote. Simuliona hiyo jamaa? Simuliona? Mitego haina gani?
Raila severally made reference to Gachagua's sentiments immediately Kenya Kwanza took power, when he claimed people outside government would not be entertained at State House.
Hiyo mtego ya Gachagua. Aliweka mtego kule kwa State House. Anawekea baba mtego. Ati hakuna mambo ya handshake. Hakuna mambo ya nuzumukati.
Raila, who is vying for the chairmanship of the African Union Commission, said political leaders in the country should not be self-centered.
Tendawili, mtego wa panya kuingia waliomo na wasiokuwemo.
His sentiments were earlier echoed by the ODM brigade that attended the homecoming ceremony.
Nimeona Gachagua analialia hapa town. Unajua upinzani si rahisi. Wakati wewe ulikuwa unafukuza baba, hata ulikuwa unapiga gari yake na risasi mingi sana. Wewe ulikuwa pale unajipiga kifua. Sasa wewe umeingia pale, ukifukuzwa kidogo na viti namna hii, unaanza kulia machozi, inajaza bakuli mzima.
Hii uongozi wa urais imekaa huko sana. Lazima tuulete pande hii kwa nguvu tu, nyinyi mkipenda.
Raila also urged the government to work with church leaders to foster unity and peace. The Kenya Kwanza government was also urged to ensure devolution continues to make headway in the country by dispersing county funds early and efficiently.
Serikali ya counties ziko na shida. Hawapati pesa ya kutosha. Tulisema ati minimum 15%. Lakini kizakikana nataka iwe 20-30%, sio? Sasa mimi nasema hawa wabunge wenu ni sawasawa. Lakini wabunge wanapingana na serikali ya ugatuzi. Wabunge wenyewe wanataka wawe ndio wanafanya mambo ya kandarasi.
Nimrod Tabu, Citizen TV.
And at the same time, Wiper leader Kalonzo Musyoka has slammed the government over increasing cases of abductions and arbitrary arrests, such as that of Savannah Clinker chairman Benson Ndeta.
Kalonzo, who was in the company of other opposition leaders, called on the clergy to pray against the culture of abductions. Maria Nyambura has more.
Wiper Party leader Kalonzo Musyoka and a host of other opposition leaders joined Catholic faithful at the St. Joseph the Worker Parish in Racecourse, Nakuru. Kalonzo sustaining attacks on the Kenya Kwanza administration over increased cases of harassment and arbitrary arrests.
Hivi vita vyote ni juu ya inahusiano mkubwa na the so-called affordable housing. A Kenyan businessman, well organized, akapata ushindi. They want to stop him.
Kalonzo also pointed an accusing finger at the government over the rising cases of abductions in the country, warning against such vices. Similar sentiments were echoed by other leaders.
Tunasema the next round of maandamano will not just be Gen Z, it will be Gen Zote. Because Kenyans cannot take it anymore. Sasa mwenye analipwa mshahara kwa mfano, wanaochukua ushuru is like half a half. Na hiyo pesa wa Kenya wana shida na kutoa ushuru, lakini ushuru unatolewa na wanaenda kwa mifuko ya watu binafsi.
Let's return Kenya to being a country under the rule of law, not a country under the rule of lies. And it still remains, they are still telling lies even as we speak. The bishop said they should stop the abductions. As we speak, abductions are still going on.
The opposition principals urging the clergy to stand against poor governance of the country, despite criticism from politicians. Maria Nyambura, Citizen TV.
The Ethics and Anti-Corruption Commission, EACC, has arrested 2 officers who are said to have colluded with officials of the Kenya Maritime Authority in an insurance scam amounting to 40.5 million shillings.
That's right. Now, the 2 who were arrested separately in Nairobi and Mombasa have been processed and will be arraigned Monday to answer questions of economic crimes. Once again, our very own Stephen Little.
After months of trailing suspicious dealings between Liaison Insurance Group and the Kenyan Maritime Authority, KMA, the EACC detectives detected ongoing corruption in securing of medical insurance tender at the Coastal Parastatal. Quickly, the investigating officers went to court seeking for orders for such warrants against suspects linked to the multi-million shillings fraud. After securing the court orders, EACC conducted raids in Nairobi and Mombasa offices of Liaison Group Insurance Brokers and arrested 2 officials, General Manager Julius Kitheka and Mombasa Branch Manager Danson Kaba. According to EACC, the 2 are accused of masterminding the fraudulent scheme on behalf of Liaison Insurance Group, working in cahoots with Henry Mwasaru, KMA Head of Human Resource and Administration, and Babalin Lundu, who is the Head of Supply Chain Management. The 2 officials fraudulently secured medical insurance worth 40.5 million shillings for KMA staff, group life assurance for staff and board members of KMA. According to the EACC, preliminary investigations revealed that Liaison Group Insurance secured the tender through bid rigging, and the tender was prepared and finalized by senior officers in the insurance company and sent to KMA for advertisement to invite bidders. EACC spokesperson Eric Ngumbe says the operation that included search of the suspects' properties has yielded evidence that will support the ongoing investigation. EACC has shifted focus to procurement of staff medical insurance cover in public institutions, which some officials are now using as a conduit for embezzlement of public funds through bid rigging and kickbacks. Stephen Leto, Citizen TV.
Let's now get into our special coverage this World AIDS Day, 40 years after the first case was detected in Kenya. And as things stand, there are about 1.4 million people living with HIV, which means Kenya has the 7th highest epidemic globally, and that is behind South Africa, India, Mozambique, Tanzania, Nigeria, and Zambia. The prevalence rate is 3.3%. If you're wondering what prevalence means, it means that out of every 100 Kenyans, 3 have HIV. Let's take a look now at the number of new infections in 2023, and the number is more than 16,700 new infections. Most of them, about 8,900 affecting women and 4,000 among men. Now, 73% of that figure accounts for adolescents and youth, young adults aged between 15 and 34. Now, there were 20,400 AIDS-related deaths last year, approximately, an increase of 2,000 from the year before that. It's also worth noting that while males account for 35% of all people living with HIV, close to half of all AIDS-related deaths occur among men. Now, let's take a look at what the situation is in the counties. And as of 2022, 58% of people living with HIV were domiciled in 10 counties, leading Kisumu, followed by Homa Bay, Migori, Siaya, Nairobi, Nakuru, Mombasa, Kiambu, Kakamega, and Kisii. So these account for 58% of persons living with HIV. At this point, let me hand it back over to you, Jeff.
That's right. Thanks so much for that, Olive. Now, Serafina Achieng Ouma takes a deeper look at the statistics by the National Syndemic Disease Control Council, where Kisumu County bears the highest burden with a prevalence rate which is more than 3 times the national average. Take a listen.
The latest numbers depict a great geographical disparity nationally, with Kisumu County topping the list with the highest prevalence rate of 11.7%, which is more than 3 times the national prevalence of 3.3%. Over 135,000 people are living with HIV in Kisumu County, ranking it high, not just in the leading Nyanza region, but among all counties nationally, followed by Homa Bay County with 109,786 people, Migori with over 106,000, and Siaya County, which has 93,368 persons living with HIV. Other counties like Busia, Mombasa, Nairobi, Uasin Gishu, Kisii and Nyamira are among the top 10 with a prevalence rate ranging between 3.5% and 5%. Only 7 counties, mostly in the arid and semi-arid region, had a prevalence rate of below 1%, with Wajir County having the lowest rate at 0.1%. And while there has been a steady decline of new HIV infections in the last decade from 101,448 in 2013 to 16,752 in 2023, an alarming trend is picked among adolescents and young adults aged between 15 to 34 years who contributed to 73% of all new adult HIV infections in 2023. It is also noteworthy that 51% of the new infections occurred in only 9 counties, including Nairobi, Kisumu, Nakuru, Migori, and Homa Bay. Despite the grim statistics, notable progress has been made in HIV response, with 1.3 million people living with HIV now on ART, a 14% increase in condom use, and 97% rate attained in identification and treatment targets, and a national viral suppression rate is currently at 94%, with the adoption of pre-exposure prophylaxis currently standing at 61%. HIV among children remains a major concern, with 63% of the cases resulting from mother-to-child transmission. The HIV mother-to-child transmission rate stood at 7.3% in 2023, which is way above the national average of less than 5%. This may have been influenced by the steady drop in antenatal clinic attendance from 96% in 2021 to 88% in 2023, mostly among pregnant teen girls aged between 10 to 19 years. Safin Acheng Oma, Citizen TV.
Despite progress made over the 40 years that saw the country's HIV infections decline by 83% in 10 years, funding remains a major hurdle in the fight against HIV. While leading the commemoration of the World AIDS Day, Health Cabinet Secretary Deborah Mulongo called on donors to continue supporting the war against the pandemic.
Let's get more from our very own Seth Olale.
It's a race against time as Kenya strives to end HIV and AIDS by 2030. A journey that involves both the able and persons with disability, with an aim of reaching the 2030 finishing line. Kenyans from all walks of life join the world in commemorating World AIDS Day in style. Other than the half marathon, participants were entertained at the Youth Global Village that was climaxed by a colorful festival. But even as the country celebrates notable gains in reducing the prevalence rate, funding is threatening to slow down the race against time in the fight against HIV and AIDS.
And I'm seeing this as one case that is going to derail our process if we are not careful. We have to be ambitious to end AIDS by 2030. If we are not, we will not end AIDS by 2030.
It is time we had honest conversation on self-reliance and charting the path to a sustainable HIV response.
With less than 6 years left to the 2030 HIV/AIDS-free target, work is clearly cut out for the government and donor partners.
We are calling upon everyone to celebrate the 10 years of success, but to refocus and purpose that we shall stop being silent about HIV. We shall talk to our children.
As the race to end AIDS by 2030 gains momentum, the government says it will require a collective responsibility both from donor funds as well as on-source revenue. Seth Olale, Citizen TV at the Nyayo National Stadium in Nairobi County.
All right, Seth, thanks so much for that. On that note, we're going to go straight to our studios in Kisumu City, where we find Homa Bay Governor Gladys Wanga standing by. Governor, good to see you as always. Thanks so much for your time.
Governor, let me begin by asking you, in those figures... Sorry, you can go ahead.
Thank you, Jeff, and happy to be here.
All right. In those figures, we looked at Homa Bay comes second to Kisumu in the counties as of 2022 in terms of the counties that have the highest number of people living with HIV/AIDS, 10 counties accounting for 58%. What are you doing at the county level?
Thank you, Olivia. There's been a lot of interventions, and we are moving from about 26.5% in 2007 to about 10.7% now. I think that has been, we're not where we want to be, but there's been great progress in terms of new infections and in terms of prevalence as well. So what we have done is to improve our health infrastructure, ensure that we have comprehensive care clinics in all our facilities or most of our facilities, and also to ensure that we are integrating HIV services into our healthcare delivery throughout. Because what you recognize is we are celebrating HIV at 40, which means that those who got infected when they were maybe 20 are now 60 years old, or those who got infected at 30 at the beginning are now 70 years old, and therefore seeking care for other ailments as well, you know, because they are managing HIV, but they're also dealing with diabetes. They're dealing with every other ailment that comes with age as well. So we are integrating HIV care into all our services. We're also dealing actively with the triple threat of new infections, but also of teenage pregnancies. You saw from the report how much new infections we're having among adolescents. And when we were, you know, looking at mothers not going to clinics, and these are mostly teenage mothers, and Homa Bay, as well as, you know, other counties in our region face a disproportionate amount of teenage pregnancies. If you walk into any facility, you're looking at about 23% of our girls getting into teenage pregnancies. We're also looking strongly at elimination of mother-to-child transmission, which is a program that we are pushing hard. We are now at 7.9%, but we hope to get it lower. Building capacity continuously of our healthcare staff in terms of HIV care. But I think a big challenge has been highlighted around funding. HIV has been very, very heavily partner supported. And as we keep moving closer.
Sure. Governor, if I could just intervene, sorry to cut you off, but the 23% you just mentioned, that's a high number.
Extremely. It's very, very high, and it is extremely concerning. Every facility, Jeff, that I walk into in Homa Bay, there is 100% chance that I will meet a mother who's under 18. And this is something that we are facing head on, because we are talking to our young girls, we are mentoring them, we are talking to the parents, we are trying to look at the root causes of these teenage pregnancies and how to stem them. Because a lot of times these are futures, you know, that are being curtailed, or people not being able, young women and young girls not being able to achieve the fullness of their futures. And these are, you know, dreams cut short. And Jeff, I agree, it is very high, but we have recognized it and we are dealing with it. We looked at our numbers last year and our numbers this year, and there's been a slight reduction across the region. We are having programs as women leaders. We are having, like next week on Friday, we'll be having Sigan Nyenam, which is women leaders from the Lake region coming together to actively advocate against the triple threat with support of the UN agencies and NSDCC. So we have recognized it, and we are dealing with it, and we hope to make progress.
Governor, you were addressing the question of funding, and you had mentioned that there is a push towards having these programs financed domestically. What then do you see as the way forward?
Thank you, Olivia. When we appeared before the Commission on Revenue Allocation as the Lake Region Economic Bloc, we made a case that our counties are dealing with a unique situation, because if you look at the 10 counties that are carrying the highest burden of HIV, a very high number of them are in the Lake Region Economic Bloc. And so we made a case and said, as we are doing sharing of revenue, as we put money for agriculture and for population and for these other elements, can we also recognize counties with a high disease burden of HIV? Because if we are going to fund these HIV care, treatment, and so on as counties, then we will have to have additional money coming from our share of revenue. And that only comes with a recognition in the formula for revenue allocation that there are counties dealing with a high disease burden. Because as we look at it currently, partners are facing, and partners mostly in HIV space are mostly PEPFAR and American funded. And there has been a continuous reduction and a continuous need for counties to step up the amount of money that we are putting into HIV care. For example, at the moment, partners have been covering a lot of staffing for us, but sorry about the earpiece.
No problem. It's all
but
TV.
You find that, these partners have withdrawn, some of the stuff that they are putting, and it's not because of the partners liking. It's because there is consistent reduction in funding, and we are discussing with the partners a transition mechanism. But I can tell you, Jeff and Olivia, it is going to be very hard to transition within the resources that we currently have. We might actually slide back into the days that we had HIV as a big problem with the current scenario.
And that will be very, very sad, Governor. But stand by. We're going to come to you in a little short while. Just want to let you know we have in the studio here live the Cabinet Secretary for Health, Deborah Mulongo. She's here, as well as
Shalon Watiri, and she is a HIV youth advocate. Good to have the two of you in studio.
That's right, and we'll be joined by the Governor. Governor, stand by. We'll be talking more about this. It's World AIDS Day today, December 1st, 40 years since the first case was detected right here in Kenya. Let's take a break. Keep tweeting at Kwenenga Jeff.
At O'Burrows, at Citizen TV Kenya.
The hashtag is Sunday Live. Sunday Live takes a break. We'll be back in the meantime. Coming up.
I was told just to become unsocial. Don't hide.
A pill a day. Odera's ARV 19 years routine that has kept him alive to date.
As a parent, you want your little one to experience all that life offers. To touch the world with an open heart and curious mind. But the world, for all its beauty, holds unseen dangers. Germs, bacteria, tiny threats, waiting on every surface.
Dettrex protects you and your family from disease-causing germs.
That's why I choose Dettrex.
Allow you the freedom to be yourself all day long.
Dettrex, endorsed by Kenya Progressive Mass Association. Bidhaa bora kutoka Pwani Oil Limited.
These days, you have to shop smart as everything is so expensive. I shop smart. I always get a good bargain when I buy my mbogas from Mama Chege. I shop smart. I buy the 1 kg of Msafi, which costs the same as 500 grams of a popular detergent. I shop smart. Msafi removes tough stains and keeps clothes bright. And its pleasant fragrance keeps clothes smelling fresh. Chagua smart, value maradufu, na Msafi.
Kote nchini mbele tuendelee, mbele Kenya twende mbele,
Kenya twende mbele. NCBA, go for it.
Kick off the festivities in Dubai na View Travel. Join our December 13th, 2024 fixed departure and enjoy an exciting half-day city tour, desert safari with dinner, Dhow cruise, breakfast, round-trip flights, airport transfers and visa processing included. All this and more in 5 days, starting from $875 USD per person sharing. Book now. Limited slots available. Visit viewtravel.com or call and WhatsApp 0703 254 254. View Travel. Dream, explore, discover.
Are you a property owner, developer, or real estate professional looking to elevate your business? Introducing PropCut by Username, the game changer you've been waiting for. This is an online real estate marketplace that lets you list your properties, products, or services, reach potential customers, and sell faster. Your success starts right here. List your properties, products, or services quickly and easily. No commission fees, just affordable listing rates. Reach the right audience and close sales faster. To get started, visit propcutbyusername.com or call 0743 000 333. PropCut by Username. List it, find it.
Getting an education policy from an insurance firm of your choice ensures you save for your children's education over a period through regular payments. In case of your untimely passing, the policy ensures your children's education continues. Upon maturity, you receive the full payment including all the bonuses earned. Talk to an insurance company and explore the best policy for your children's education needs. Visit www.akiinsure.com for more information.
Baadaye auntie.
Mkuu, umetufikisha home poa. Asante. Pia wewe pata kakitu ikufikishe home.
Nunua any 280-gram Cadbury Dairy Milk Packs ama Cadbury Drinking Chocolate. Visit cadbury.africa uandikie someone special your heartfelt message ya kumshow thanks. T's and C's apply. Cadbury, there's a glass and a half in everyone.
New faces.
Women do enjoy your high school life. It only happens once.
No, who's arriving at this time?
New stories.
Hi, baby. It finally happened. There's nothing to worry about. I'm a big girl.
You two are in the same dorm, same room.
You play basketball. Basketball ni life yangu.
Are you ready to bring your fashionista dreams to life? Apart from me, what are you into?
Now, back to the court.
No, nimekuwa shadow yake ni stage to sneak out journalism.
Focus, discipline. Pa is back for another thrilling season, only on Citizen TV.
When I have back pain, I reach for 2 tablets of Panadol Extra. It's boosted by caffeine for fast relief of strong pain, like headache, toothache, and muscle pain. And I am finally released from pain and ready to be there for those who need me. Try Panadol Extra for fast and effective relief from strong pain.
Yule mtu kama yule tuko naye hapa anakuja kununua. Ndio anajua atakata kiasi fulani ili anataka.
But boss aliniambia you have a younger wife. Ulikuja huku kusaidiwa ama kutafuta umbea?
Dajukiz,
mama yako alikufundisha kupika. Na mimi nikakufundisha kuendesha gari. Gari hili ni lako.
Soko, more than a meal.
It is exactly 38 minutes past the hour. Welcome back to Sunday Live. here at Citizen Television. Now, at 88 years old, Dan Odera is arguably one of the oldest people living with HIV in Kenya.
He has lost several family members to the virus and chose a lifestyle change free from stigma from his community that has seen him live with the virus for 19 years. His is a story of hope and content that he spreads to his community to help create awareness. Here is Dan Odera's story.
Dan Odera is a man of routine. Every day for the past 19 years, he pops this pill at 8 a.m. sharp. It's been 19 years since his HIV-positive diagnosis and 19 years wondering just how the virus could have crept into his body.
I developed severe headaches and shivering. When I went to Chulaimbo Hospital, the diagnosis that I had very strong malaria. And then by that time, they took my blood smear. And when the doctor came and said, well, you are a bit affected, you've got HIV, but we can put you on drug. They put me on drug, and I came back home as a man of life. Then they followed, the nurses followed me up here after 1 week. They said they would like to take me with my wife to Kemri so that they can identify whether this one has got one or not. Then from that time is when I was diagnosed that I had it, but this one was pure negative, positive, negative.
Odera lost his wife in 2000, having raised 12 children with her here at Sinaga village in Siaya County. He later remarried in the year 2001 and had 3 other children with his second wife. Unfortunately, he lost a few of his children. Some, he says, was due to HIV.
How has life been for you? I was told just to be calm and social. Don't hide. Just tell people that you are positive. And don't try to give to other people. So from that time, I insisted that I should not actually have sex with any woman or any girl except my wife.
The news about his status had worried his children due to his age. In 2006, he was circumcised, but it was only in 2010 that he chose to speak openly about his HIV status and made peace with it.
2010, I decided to go and say myself in front of the people. But I said, I was told that not only sex can make you have this, but probably some cat, you meet somewhere, somebody was shaving you, and then this thing costs you. They know that Dan is one of us, and I know she's one of me. But I said, but keep yourself clean. If you want to go about Sauriako and distribute it to other people, it will be your own problem. And God will take you very soon. So the community, they know, even the church.
Dan, who is 88 years old, is among the 1,377 million Kenyans living with HIV. This is according to the National AIDS and STIs Control Program. Drastic lifestyle changes and faith have seen him survive his darkest days. He developed vitiligo, or locally known in Dholuo as rapala, meaning flowers, a skin condition caused by the virus, which he wears with pride as he goes about his life.
So I do take my time to look after my gombes, animals, and work on my farm. I do plant a lot of maize. I sell to other people also. I've got bananas, I've got cassava, or viazi, all the fruits you can see, many. I've got my gombes, milking cows. I sell even milk to other people. So I keep on staying at my home, looking after my properties. I don't roam about, no. I don't go for changa and the rest, no. You see? So that's my hobby, my work, my motto.
Every Sunday, he uses the pulpit to spread messages of hope and encouragement to his neighbors living with the virus. For them, the silence is an oblivious sellout of the stigma in the village. He grew particularly keen on the younger folk due to high cases of alcoholism and lack of abstinence, which also contribute to the 22,000 new cases of infections in the country.
I go to the church and just tell them that you be careful. Right here, I've got two good boys, strong boys. I'll advance them. I've got a daughter in Nairobi, so graduating very soon. I told her that you must keep yourself. Don't allow anybody to joke with you or do something with you. And you people, if you want it, use a condom. Here I've got how many? There are so many young people here. Our community alone here, maybe over 100 and over young people, below 30, very many.
This year's World AIDS Day theme is to take the right path. My health, my right.
They are there in a pocket. If you want it.
For Dan, his infectious laughter and good health are signs of the path he has chosen, that of every man for himself and God for us all. Brenda Wanga, Citizen TV.
The pills that help hundreds of thousands of people living with HIV are free in Kenya. But for those living with the virus in Lamu, there is a different cost.
That's right. As we continue to tell the stories of Kenya's HIV journey to 40 years later, we look at the paradox that haunts parents and patients and overwhelms the healthcare system in Lamu County, where a lack of budgets to support community interventions transforms free medicine into an expensive luxury. Take a listen.
Kitambo kuna wakati tulikuwa tunaletewa madawa pale nyumbani kwa support group. Tunaletewa dawa hapo, tunachukua hapo. Sasa saa hii kipindi ya miezi kama miwili hivi, mitatu, kuna shida sababu lazima ufuatie hapa na ni bali. Hivyo unafuatia, umekuja miguu, utarudi miguu. Nyumbani hivyo maisha yamekuwa magumu. Pengine huna chakula. Na ile dawa huwezi ukameza ukiwa huna kitu ya kukula. Kwa hivyo saa zingine huwa mtu anaruka.
It's been 2 months that she skipped her HIV medication. She's fully aware of the implications. Hers is a case of a spirit that is willing but body won't let her.
Kama tunaweza letewa dawa kule mashinani, hiyo ni kitu kimoja, inaweza fanya maisha iendelee. Kitu kingine, kama naweza pata mtu wa kunisupport na chakula tu, hiyo hata nayo inafanya maisha iendelee.
She knows that it is possible to get the kind of support she's asking for because once upon a time she had it.
Pale Kenyatta tulikuwa tukienda tunapewa transport. Na siku hiyo tumeenda tulikuwa tunapewa kitu ya kukula siku hiyo. Lakini huku hata ukikuja hakunanga kitu. Hakuna transport, hakuna nini.
Others living with HIV in Lamu County can relate to her struggle.
My name is Daniel Kimani, married to one wife and blessed with 5 children. I live in HIV status and I've been in the same for the last 29 years. My wife, the same, is HIV positive, but the 5 children are all negative. Currently, we do not have any support from any organization, no donors in this county. Again, we also had peer champions who were also trained and supported by the same organization. These peer champions were doing what we call default tracing. But today, a bigger number has also gone back to that. They have defaulted.
40 years later, counties like Lamu are still struggling with community outreach program. And the struggle may take a while as financing for such program dwindles. Hard is what Lamu County is accustomed to when it comes to financing its HIV programs. It's not for lack of trying, though. The county gets the least budget allocation from the Exchequer. This is based on its population of about 150,000.
The effect is lack of robust screening, testing, and preventive programs. So you find that the little money allocated tends mostly to go to the facility-based intervention. HIV is basically a community disease. For you to actually intervene, you need more of community-based interventions and programs to target specifically outreaches. People are more comfortable accessing testing and counseling services in the form of outreaches rather than facility-based, for the obvious reason of stigma. We feel that this is quite a huge lost opportunity.
Unfortunately, we do not have anybody to support us in terms of the logistics. Majority of the community do not even know the existence of the PrEP.
Those living with HIV carry this burden silently. But why does Lamu County not get the support for its HIV programs similar to other counties?
They say a prevalence rate of 2.2% is low, which to them does not warrant much intervention. However, we were at 1.5% just 2 years ago in terms of prevalence. So there is that increase in terms of prevalence, and I would mostly attribute it to one is new infections. Because of that lack of awareness and community-based interventions, the level of defaulters will definitely go high, and not just for HIV, but infections or opportunistic infections.
While bureaucrats shuffle statistics, in Lamu, HIV care isn't about percentages, it's about survival. Every delayed boat ride to the clinic is another day someone's parent, child or neighbor fights to stay alive.
As people have started defaulting, unfortunately we lost one of our kids last month who passed away due to that because the lack of support. You know, when he is coming, he needs the support. We also tried, but we could not do it further.
We were supported by a sub-recipient through Global Fund, helping us with PMCTC issues and defaulter tracing. But since the funding, the Global Fund ended June this year, so that one has also gone. So we are left with none. We are struggling, supported by the county only.
Lamu County is moving forward the best way it knows how. Here, the fight against HIV isn't just about medicine. It's about ingenuity, compassion, and the relentless pursuit of hope in the face of adversity, even with limited budgets.
All right, on the heels of that, joining us live in the studios, we have Cabinet Secretary for Health, Deborah Mulongo, and also activist Shalin Watiri, 24 years old. She was born HIV positive, and she's still looking strong as ever.
And she has a 3-year-old.
She has a 3-year-old who's HIV negative.
Yes. Unbelievable
story. Welcome both. Welcome.
Thank you.
Waziri, thanks for your time.
I'll start with you, Waziri. Listening to that story from Lamu, and they're talking about the logistical challenges of, yes, the medication may be freely available, but they're facing logistical challenges accessing the health facilities. They say when they visit Kenyatta, at least they would be given something to eat before they take their medication. Here they're saying, you know, they're on their own. And then there's also the aspect of, they're saying, defaulters, for example, tracing them was funded by the Global Fund. That funding ended in June. Do the counties have the capacity to pick up the slack?
Yes, thank you. Thank you so much, Olivia. And really, let me just start from the beginning. In the 1980s, as we know, when HIV began, or when we got the first diagnosis of HIV, there was a lot of stigma, there was a lot of fear and discrimination. But from 1999, when we had political will and we had the government coming in, partners coming in, resource mobilization, a lot of collaboration, a lot of guidelines coming up, and comprehensive clinics being set up, then we saw that infections had gradually reduced. And even 10 years ago, we saw that there were new interventions. Now we have the injectables, we have the oral tests, and really a lot has been done. And actually, we are seeing that the HIV infections, the new infections, have drastically reduced by 83%. People are no longer dying out of AIDS-related diseases because it has reduced by 68%, and mother-to-child transmission, just like Sharon, we see that it has reduced to 63%.
That is over what period?
Yes, over the period that we've had the
40 years?
Infection. Yes, yes. So now you notice that there's really impressive, things that have been going on, and we have made drastic steps towards that. There's a lot of momentum, and we don't want to lose out on the gains that we've accrued over the years. And definitely when we talk about Lamu, and especially the fact that they're saying the donors' funds are dwindling. We are not having a lot of donor support. Definitely PEPFAR Global Fund, we really appreciate the various donors, the various implementing partners that have been supporting us throughout these years. And actually the gains we have had is because of partners. But now with the dwindling funds, we need to think of sustainable solutions. We need to think of domestic funding, all right? So for Lamu as a county, yes, we need county government intervention. At national level, we have established the community health programs. We've had the guidelines. We are sending commodities there. We are offering technical advice, among others. But again, at national level, we need to come up with interventions that are sustainable. And that is why we are talking about Taifa Care, Social Health Authority. Okay,
we'll get to that, Waziri. We'll get to that in a moment. In the meantime, Shalom.
Yes, ma'am.
You have an amazing story. 24 years old. So you were born in 2000.
Yes.
Right?
Yes.
Tell us your story.
I'm Sharon Wateri Macharia, a girl from Nyeri, from Majengo slums. Yes, I was born, raised, schooled, and now volunteering in Nyeri County. Back in 2005, back in my childhood, I was that sickly child, on and off, 2 weeks in the hospital, 2 weeks at home, 2 weeks in the hospital, 2 weeks at home. Now, there was this particular day, I remember it like yesterday. It was on Saturday. Me and my younger sibling, we are home playing. Now my mom called me and she told me, you know what, Sharon, I want you to go and get me something. It was a small container, almost this size. So she told me we had a kiosk back in Nyeri, where Naivas is. Previously it was a Tusker Depot, and we had a kiosk. So we used to take sodas, soft drinks of any kind. But me being a sickly child, obvious, hakuna maji ya baridi, hakuna vitu baridi. So that particular day, my mom told me, you know what, you're now going to take the soda. Me and my younger sister. So we drank the soda. Luckily or unlucky, we didn't know that it was poisoned. Yes, it was poisoned by my mom, because she went to the clinic and she was told that she is HIV positive. At that particular time and moment, that was when stigma was a monster. Yeah. And when you hear the mention of the word HIV, you're like, you're going to die tomorrow. Yes. So now my mom, that was the best option that she could have done. So she poisoned me and my younger sister and told me that when Dad and my older brother comes home, tell them that to take the soda from the cupboard, not from the crates. And I was like, yeah, Mom, I'll do it. So yes, we took the soda. And now my dad came home. I don't know what time. And then she was like, Sharon, where are you? Sharon, where are you? So I told her, Dad, I'm sick. And obvious, I'm the sickly child. So mbio had PGH, because at that particular time we were living in Kangemi. So there my father went and he was told that your daughter is poisoned. It's like, wow, now where to? Then the police. My brother is still at school. He was stand 8 by then, the tuition and everything. So my brother went home And the neighbors, you know, Sharon is not at home. Ameenda na babako, amempelekwa hosi, amekuwa msick tena. And yes, so akaosha mtoto wetu, my younger sister. Unlucky, my sister passed on.
Because of the poison?
Yes, because of the poison. Yes, now you know, it was like a movie, chaos everywhere. Yeah, you know, yes, have you heard? At that particular time, my mom was called Mama Bonnie. Bonnie is my elder brother. So have you heard? No, stigma was everywhere. And I believe as ladies and every person has a friend. Now that my mom had told her friend that, you know what, I went to the hospital, I was tested, and I'm HIV positive. No, the story was everywhere. The story spread like everywhere, and even in the news, even in the broadcast, and it never went well with me, and even my dad and my family at large. Lucky, unlucky, my mom also passed on. And I remember the last words she told me. Sharon, forgive me. This was the last thing I would ever done. And I was like, I was 5 years. So, unasema nini, mom? Miss Kwelewi, and I was on a wheelchair having a drip. I remember that scene. So after then, in my primary school, I've gone to several primary schools due to stigma-related issues. Yes, because I remember there's that particular school that I schooled just only one term. And then, boom, my dad was like, no, you're not going to study there.
What would the kids tell you? Or if they learned you were HIV positive, what would they do? What were the kind of things they would do?
They would play with me. I remember, you know, being children, we usually fight over some things. And then I was that girl that I rolled my eyes and I told her, I don't know what I told her. Then nikamwaga mate. And you know what she told me? Namwaga mate come to her HIV. Wow, I cried. For her, she thought that she has won. But for me, it's like, it's true. Whatever you're saying, and it was like, nilikuwa nauliza. By then, nilikuwa naishi na shosho yangu. So I was like, kwani mtu ana HIV na mtemanga mate inakaaje? So I would tell my friends, hebu tema mate nione, so that confirm kuna mate particular ya watu HIV and watu nye ni HIV negative. Yes, and I also remember another scandal when I had HIV, like...
Did they know you were HIV?
Yes.
Did they know?
Yes, they knew, but I never told them.
All right, Madam, yes? Yeah, sorry. Is it, you know, over the 40 years since 1984 to date, from 2000 now to 2024, is it access to medication, greater awareness that have, and you'll tell us whether this is true, that has seen HIV/AIDS no longer viewed as a death sentence?
Yes, a lot has been done in terms of creating awareness, especially at community level, with work previously by community volunteers who we now call the community health promoters. We've had a lot of health education and a reduction in stigma. Equally, previously we had a lot of infections, what we call opportunistic infections like TB, skin diseases, you know, weight loss, among others. But we, after starting patients on antiretroviral therapy, now we see that they're gaining weight, the viral load drops or it becomes undetectable. And that way even, that's when we are seeing that we are having undetectable is equals to untransmitted. Yes. And so now that's why we are having even, you know, mothers giving birth to children who are negative, or even discordant couples where one couple is positive and the other one is negative. So with ARVs, with community awareness, and all these other interventions, having everyone informed that you can actually live your life, even if you're a person living with HIV, they have really improved the quality of life among HIV patients. But as Honorable Wanga has clearly said, we are having patients living longer, and so we are getting patients having non-communicable diseases like hypertension, diabetes, cancer, among others. And that is why now we are thinking of a comprehensive package, integrating them into the health system and ensuring that their medications and the patients can have that comprehensive management and quality of life.
Absolutely. We actually still have the governor on line right now on Zoom. Governor, if you can hear us, the stigma, is this still a big issue in Homa Bay?
I think Jeff, yes, I can still hear you. No, I don't think stigma is a very big issue now. I think people openly, go to clinics and take their medication. And our community health promoters, which is a program that we've worked on together with, the national government, I think they have demystified HIV. And people are living normal lives, normal, long, healthy lives. I think it is largely demystified. Yeah.
And I'm curious, Waziri, before I ask Shalon to come in on a demographic people are worried about, and that is adolescents and young adults. In terms of funding, because when we looked at the Lamu story, Governor Wanga, we saw the question of donor funding is being rolled back, and so funding, for example, for finding patients who are no longer coming to get their medication is no longer there. So yes, the medicine might be there, but accessing the medication is proving a challenge in a county such as Lamu. So, with health having been devolved, the county governments bear the responsibility now. So what would you have to say to the CS in terms of, putting your heads together as a Ministry of Health and the counties when it comes to addressing this shortfall in funding we will get? Governor Wanga?
Yeah, thank you. I think that the shortfall in funding requires a lot of creative thinking and how we are going to get out of it. National government alone or county governments alone will be unable to shoulder the funding burden. And then, of course, I empathize with the Lamu situation because in Homa Bay we also have many islands in Fangano, Ringiti, Remba, some far-flung places that sometimes logistics become challenging. But with community health promoters, there has been, our community health promoters have shouldered a lot for us, even in terms of HIV care, in terms of identifying the people who are on medication, following them, tracing them actually, defaulter tracing, and getting to their homes and what needs to bring them to the facilities. And then also taking our medication to the farthest areas so that they are easiest to reach. So we're going to use the little that we have. We're going to have to use the little resources that we have to stretch for longer. And that, of course, includes our community health services, which is a big cog in this wheel of HIV care. And really kudos to our over 100,000 community health promoters across the country. Doing a good job every day in trying to manage the day-to-day of our healthcare services.
Governor, we're going to let you go for now. Thanks so much for your input live from our Kisumu studios at Ramogi. Thanks so much for your time. Was there, at the same time, the numbers 18 to 24 are on the rise, right?
Absolutely, yes.
What is that about? How can we stop that madness?
Yes. So first of all, let us be cognizant that there is a decline in the number of HIV infections, but out of the 17,000 new infections, 6,000 are from the young and adolescent group. So we need to have policies and interventions, and what we are doing as a ministry is number one, to improve testing in various communities where we are having the young adults and adolescents. So this includes the TVETs, the colleges, the universities, etc. Equally, we have new innovations to improve self-testing, like oral test kit or blood test that they can do at home. We are also improving health education among them and having risk and vulnerability assessment for them to identify. Equally, as a ministry, what we have been tasked in our performance contract is to establish youth-friendly clinics. And in this, then we can have the youths coming in and also getting tested and being informed. So it's really, again, a collaborative effort and engaging them further to identify the challenges and working towards having better outcomes among them. Yeah.
Yeah, you asked that one.
That's why you're looking at me.
Yeah.
Okay, look. Madam CS, when we used to walk into a bathroom, whether it's a bar, a restaurant, wherever we were, there was a condom dispenser. Yeah. How do you know?
So I used to walk into bathrooms.
Oh. And then you reach out and you get like a 3 so how come there are no more of these? What happened to those condoms?
Yes, we are working towards that, and as I have said earlier, dwindling donor funding. And I hear a lot from the Lamu story everywhere. Everyone is saying, we need a lot of support from outside, we need funds from outside. But let us look at self-reliance as a country, because, governments change, policies change, and we cannot always just focus on external support. We need to be self-reliant.
And Trump on the 20th of January might wake up and say, you know what?
And not just that, when President William Ruto was in the US for the state visit, it was part of the agenda that PEPFAR will roll back and that domestically will take on the burden of financing these programs. Should we be quaking in our boots, Madam CS?
Absolutely. And, I don't know if I should say it's timely, but actually we've lost a lot of time. We should have had universal health coverage earlier on. But if we have health financing that is domestic, that way we can be able to have sustainable programs, HIV, malaria, TB, even the non-communicable diseases. So this is timely.
No, but where will the money come from? I ask you that because even under UHC, there are programs which are not yet, yes, it's there on paper, but in practice it has not been implemented because we keep being told the money is not yet there when we get the money. So you're saying we should have rolled out UHC. That's well and good. But where will the money come from?
You see, the contributions that we are having, the contributions that we are asking Kenyans to have, the 2.75%, that is how we'll get financing. Commodities right now is around 25 to 40 billion for HIV. From Exchequer, we are getting 4 billion, right? So most of it is through funding. Now, I think there's need for reality, we as Kenyans to know that we need to come up with self-reliance, something that is sustainable for us. And through a health financing model, through local manufacturing of products like ARVs, etc., human resource for health, having the digital platform to improve the, assessment efficiency, etc., then we can have sustainable solutions. And so UHC is timely. What Governor Wanga had talked about, the community health promoters, we need to strengthen them so that they can go to the communities, they can educate not only in HIV, but other communicable and non-communicable diseases, even when we have outbreaks. Equally, from the primary health care level 2, 3, and 4, we need to strengthen that. And through that, we can have the first contact. Patients are being tested, patients can go for treatment. Right now, we have more than 3,700 primary health care facilities. But how do we strengthen that? That's for HIV. But we're asking ourselves, how do we strengthen that? How do we strengthen our primary care network, the referral mechanism? So it's all about a change in the health system and having sustainable solutions through domestic financing. And this is through our contributions. So it will not only address HIV, but other communicable and non-communicable diseases, even as the donor funds continue dwindling.
Well, Terry, at the same time,
yes,
we mentioned at the beginning of the show that you are HIV positive.
Yeah.
You have a 3-year-old who's HIV negative.
Yes.
Your husband is HIV negative.
Yes.
How does that work for those who don't know, like us?
Oh, I know.
Oh, okay, you know.
Speak for yourself.
Okay. It works like it's. We have a slogan that we say: "You is equals to you, undetected is equals to untransmitted." So every day when I take my ARVs, even if I get several sexual partner, but there is a risk, and I have sex 1,000,000 times, unprotected sex, I cannot transmit Why? What's the use of the ARVs? It's because I take it so that I can suppress my virus and have a healthy living. So if I take my my ARVs, I'm sorry, if I take my ARVs, the viral load, we have a test that we are done after every 6 months or 1 year. It depends. Are you an adolescent? Are you a PMTCT mother? It varies, but majority it's from 1 year. Now I have an undetectable viral load for 2 years. My viral load has been undetectable, and within those 2 years and the coming years, I'm still taking my ARVs. So the virus is asleep. Haizani ifanyi kitu. It's just there. I'm just a host of a very small virus, a microscopic virus. But it doesn't hinder me from having sex.
When you first met your husband, did you tell him?
Yeah, I did.
Are you sure?
Yes.
Ulimwambia?
Yeah, nilimwambia.
Like immediately?
No, it was not immediately. Yeah, it was not immediately because I was having that fear ataniacha.
Yes.
Yes.
Lakini once you told him, alikuwa sawa?
Alikuwa sawa kabisa. I remember, I can't say the text because I texted him a very big text. Read more. You see, that text that has read more. And then I said, I'm dead. That was the last text. Then he was like, no. The following day, he visited and he's like, no, you know what? I knew. And I know I had that assumption. We are from the same village. So, you know, and we are from we school from the same school. We go to the same church. So he has the stories. And then when people started seeing that we are dating, started hitting that, you're dating Sharon. Do you know that she's HIV positive? No, he had that assumption that I'm HIV positive. But he never had the information that it's really true. So when I told him, he was very supportive. I was like, you know what? Tunasonga. Kaende. Yes. Kaende. Yes. So U is equals to U. That's what we are saying. Undetected is equals to untransmitted. I'm also that champion. And with that slogan, U is equals to U, we have many discordant couples. Yes.
What do you tell people out there who have no idea about what you just told us right now? You know,
yes.
What do you tell them? They're listening to you right now.
I would tell them that let's stop stigma. HIV doesn't kill. Stigma does. Stigma kills. And what is stigma? It's that feeling like you don't want to associate with me, not because you've seen me here in Citizen TV, you don't want to, hey, you learn now HIV, you know, that branding, it's not good. And that's people assuming that most of the HIV people are promiscuous and then they are having sex. Like, hivyo tu hawana mpango, no. Some of us are born with, some of us had accidents, some of us maybe due to blood transfusion, you know. And one thing I usually say, no one, and I mean no one, ever kneels down and say, Mungu Baba naomba leo nipate HIV. No.
Lakini vijana watumie condom sio?
Sana. And si kutumia condom. For me, I say it's correct.
And why do you think there's that rise in infections among
the youth?
Among the youth, it's because tunapima na macho. One thing, tunapima na macho. The other thing, we don't want to go and get tested. So, today I've gone and had sex with a particular person. As my virus is high, I have copies. So, I have infected that person. And that person, I'm not the only sexual partner he has. So he goes and have sex with another person and he has not tested. So the spread is continuing and we are not using, yes, we are using condom, but it's not consistent. Tunatumia shot ya kwanza, shot ya pili hatutumii, tushajuana.
And the at-home test?
Home test. Yes, we are having home test, but ni wangapi wanafanya? Kuna time ya kufanya home test. Si nikaenda ndio nimepata form. So at the time ya kuvaa condom, you know, and having those dialogues with the youth, it's like before nivae condom itakuwa ishalala.
So the injectables do what, Madam CS?
They prevent, but we also have the pre-exposure and we also have the post-exposure prophylaxis that one can take after accidental. Yeah. encounter. Yes, but again, we are encouraging people who are living with HIV to also take their ARVs. That way, you know, there's undetectable viral load, and that way the transmission is again.
But Madam CS, those numbers are very alarming, aren't they?
Yeah,
they're very alarming.
Yeah, and if you look at the report, you know, one of the concerns that is raised is not just, you know, the young people and infection rates within that demographic, but the falling of the defaulting where ARVs are concerned, especially among the male populace. Is that something you're addressing?
Absolutely, absolutely. And that is why the theme for this year, we are focusing on the men and also the boys. Yeah, this is because possibly for the men, you know, they leave for work, they are the sole breadwinners, so they leave for work early and they come in late. So how do we identify them so that we can identify the new HIV infections? And those who are positive, how do we ensure that they are routinely taking their medicines? They are not missing medicines, they are not missing their appointments. So those are the interventions we are thinking about and coming to ensure that they are also friendly. Our clinics are friendly to the male population, the young men, and also the boys. Yeah.
And the campaign you're pushing, Madam CS, for these young people. Tell us more about it so that they can know they're watching, hopefully. What do you tell them?
Yeah, I would tell them that they need to stay safe, right? And we are here for you. We are here for you. We are actually having interventions. We'll be having youth-friendly clinics. We'll ensure that, you know, we are identifying and having interventions together with my colleagues from NASCOP and the National Syndemic to be able to address this. And so, first of all, it involves focus group discussions. I like what Sharon is talking about. How do we engage the youth so that we know, we identify the gaps and the challenges, and even for the men, and then we come up with interventions going forward.
You know, once upon a time, there used to be the ABCs of HIV.
Abstain.
Abstinence. I forgot the B.
Be faithful.
Oh, that, okay. And then there was condom.
Condom.
Correct.
Madam CS, thank you so much for your time. Shalan Watire.
Yes, ma'am.
Thank you so much for your story.
Thank you.
We love it. Thank you so much. And keep doing what you do. 40 years from now.
Did you have a last word?
Yes, I have a last word, if possible, to Kenyans. And really just to inform you that we are working together with partners and stakeholders to ensure that we have 100% health insurance coverage for all the citizens. We want to ensure that there's 100% quality of care, 100% essential medicines, and 100% human resource through a digital health platform that will be an enabling environment. And even when we think about HIV, we need to plug the outcomes, you know, have data analyzed, you know, tangible data that is telling us more on how we should improve our interventions. But what we are saying, Kenyans, let's register, let's contribute based on our financial capacity. We are also calling on development partners and implementing partners. We need you to support us during this noble cause. We are calling upon politicians again, the political elite, when we're talking about Taifa Care. We need you to support us in championing and also being advocates at your county, at your constituency. For healthcare workers, again, we need you to offer quality services to Kenyans. And for healthcare providers, we need you to contract as well as offer services to Kenyans under the Social Health Authority. And that way, we will see what we are always calling afya yangu, haki yangu, jukumu langu, to take care of myself and my family. And so with those remarks, let's not leave anyone behind. The Ministry of Health is not leaving anyone behind. No adolescents, young people, male, etc. We are working together through this journey.
And just one last one, because you mentioned healthcare workers.
Yes.
Medical interns, there is a strike threat, a nationwide strike threat.
Yes.
Where are we with that?
We are working together. Tomorrow we are going to have a meeting. As I said, human resource for health is a critical pillar. Each healthcare worker is critical in terms of health service delivery and building us to sustainable solutions. So what we are doing, we are engaging them to ensure that we are negotiating to ensure that whatever we are coming up with is going to support our people in Kenya, and our health workforce will be satisfied and happy with the results. So engagements are ongoing. Our meeting is tomorrow. Negotiations are ongoing. Yes, they are dissatisfied with the 70,000, but that was just the primary that we had used during the SRC negotiation. It is not the last amount. We will work together to negotiate further and come up with a permanent and sustainable solution for our interns as well as the other cadres.
All right, good luck with that. Cabinet Secretary for Health.
Before we let you go, we'll ask you to stay tuned to this next report. In 1984, Kenya reported its first case of HIV, sending panic and shockwaves across the country. Coupled with inadequate information about the virus, stigma was the immediate calamity that befell those who tested positive for the virus, and they would often die in isolation after enduring months of suffering. However, the country has since made significant strides in medical research and social acceptance, leading to a declining rate of AIDS-related deaths. And as the country gears up to mark 4 decades of concerted efforts to eradicate HIV as a public health concern, Laura Tieno takes stock of how far the country has come in fighting the AIDS epidemic.
At the outskirts of Kisumu City, Rosalida Auma kneads her mats. Each stroke of the crochet weaves a tapestry of hope and resilience. The tight-knit pattern illustrating persistence and a spirit that fights to rise above board. Rosalida tested HIV positive while on a prenatal visit when she was pregnant with her youngest child. Shaken by the diagnosis, she ran to her father.
Asa jambo lake kwangu ilikuwa tu, unakumbuka nikiwa mgonjwa ukiwa mdogo? Nikamwambia nikamwambia ni ugonjwa scarlet. Hiyo ilikuwa ni ugonjwa. Sasa kama umepata hii, usiwe na wasiwasi, meza tu madawa. Unaona mimi pia nikiwa hai. Na hivyo pia mimi nikakaza moyo na nikawa na hiyo roho. Juu kama baba yangu alianza kumeza nikiwa class 6, mbona sio mimi nimeze?
According to data from the National AIDS and STI Control Program, the country has reduced mother-to-child transmission of HIV to 7.4% from 14% in 2013. Additionally, 1.3 million people are on antiretroviral therapy, including 48,000 children. Rosalida is among the 7,346 clients served at the Comprehensive Care Clinic of the Lumumba Sub-County Hospital in Kisumu. Today, a peer-to-peer counseling session is underway. Every day of the week is assigned to different groups in a bid to foster a community for persons living with HIV.
Within the facility, at times you might have a client who has been exposed, and then maybe you have this client inside your room, or maybe the client has just come in for treatment, and then he's like, oh, I'm seeing a neighbor there, I will not come in.
According to the National Syndemic Diseases Control Council, 59% of new HIV infections in 2023 were recorded among adolescents aged between 10 and 19 years in 10 counties, including Kisumu, Nakuru, Nairobi, and Kakamega counties.
We have the patient line.
The new revelation calling for more concerted efforts to address infections among the adolescent population.
If we were to break the cycle, the generational cycle of new infections, the young people are the ones who get children. So when you have infections in a younger generation, then the mother-child transmission cycle will continue. And you can't break that generation of new infections. So we are very keen when we see that the rate in young people is still a concern. We must talk about it because that's the only way to cut off the continuous generation recycling of HIV.
In spite of the rising infections among the young people, the country has made significant strides, including the Undetectable, Equals and Transmissible campaign, which aims to suppress the viral load amongst people living with HIV.
Earlier, we used to have the 3 drugs separately. Right now, it is just 1 pill. Then the 3 drugs were even taken maybe twice a day. Right now, you take it just once a day. So that is how we have moved, trying to make taking the drugs as simple as possible so that we don't have the patients defaulting from the drugs.
As the world marks World AIDS Day on Sunday, in Lumumba, the clients at the Comprehensive Care Clinic are already celebrated, documented not just as cases, but dignified individuals who contribute to the country's long strides in the efforts of eradicating the AIDS epidemic.
Watu wanarudi kupatana hapo wanaoana. maisha inaendelea mbele. Sasa ni group pia inapatia watu courage. Sasa unajua ukikaa na wenzako uone hata kama ulikuwa umedhoofika na uone mwenzako amenenepa, so utasema ai, na mbona mimi nakaa hivi na huyu ndani amekaa hivi? Sasa utajaribu ujue ni siri gani anatumia, ama anameza madawa kiasi gani, ama amejilinda kiaje.
40 years down the line, we have a clear understanding of what this virus is about, what we can do about it, and we have seen systems built, interventions put in place, and people are living with HIV and able to participate in economic activities.
Laura Otieno, Citizen TV.
We're still in the studios. We still have the CS for Help, and we have Shalon Watere, an activist, 24-year-old, born HIV positive and living life and smiling.
Yeah.
Every single time. You have something you want to say?
Yes, I have one word for the youth. Yeah, for the positive living. It's like HIV doesn't define you. You're just a host. So keep on taking your ARVs. And for the negative people, let's use the PrEP medication, the PEP and the PrEP. And so that I can end, for anyone who is listening there, please, I'm just a volunteer. I would like to have a stable job. I'm a learned person, and I have a certificate of social work and community development.
Oh, brilliant.
Yes.
Snap.
Advertise tu hapo.
Shoot your shot. Shoot your shot. Shoot your shot.
Well done. Shalon Watere, Cabinet Secretary Deborah Mulongo, thank you so much for your time.
Thank you so much.
We appreciate it. All right, plenty more ahead, folks. Stay with us at Koinange Jeff.
At Barrows at Citizen TV Kenya.
The hashtag is Sunday Live.
And Shalon, in case they want to reach you, your handle?
Yeah.
Yes. I'm an influencer in TikTok. So it's Shane Macharia. Shane, S-H-A-N-E Macharia. I also have in my Instagram and Najarib YouTube. So in my TikTok handles, it's Shane Macharia.
Okay.
Yes.
Na Instagram pia?
Na Instagram na Twitter bado.
Oh.
Kwa TikTok? Uko TikTok.
Unifollow.
Okay. So we take a break, but coming up. A breakthrough in plastic pollution. How the mealworm is shaping the fight against plastic waste.